love, and blessings, everyone. It's your girl, Zila Begum, back at again with another episode where we talk about health, equity, and the human stories that often go untold. Today, we are diving into the realities of immigrant health in the United States, the struggles, the resilience, and the policies that can literally decide who gets care and who doesn't. This is an important and political topic, especially when you remember that 1 in 4 children in the U.S. has at least one immigrant parent. Our neighbors, coworkers, and classmates. This is their story. Let's start with the big picture. Immigrants make up about 16% of adults in the U.S. They come from all over the world, bringing different languages, cultures, skills, and dreams. But despite this diversity, when we talk about immigrant health, too often we hear just one oversimplified narrative, and it misses the reality. The data I'm sharing comes from KFF, the leading health policy organization in the U.S. They are not a government agency, not a foundation that funds others, and they are completely independent from Kaiser Permanente. KFF is a one-of-a-kind organization that combines policy, research, polling, and journalism to give people clear, trusted information on national health issues. Headquarters in San Francisco, with offices in Washington, D.C., they have been led by Dr. Drew Altman since 1991 and are supported by an endowment supplemented by foundation grants. Again, their work spans over policy analysis, polling, journalism, public health campaigns, and building trust in health information. The survey I'm drawing from today, the 2023 Survey of Immigrants, is the largest and most representative non-governmental survey of immigrants in the U.S. to date. So, what did the survey reveal? First, the good news. Most immigrant adults, about 79%, report being in excellent or good health. But here's where the story changes. Lower-income immigrants adults are far more likely to report worse health and chronic conditions. 14% of all immigrant adults say they have a health condition that requires ongoing treatment. Nearly 1 in 3 lower-income immigrant adults, those in households making less than $40,000 a year, report their health as fair or poor. Compare that to just 7% among those earning at least $90,000. Health coverage is another huge divide. The reality check: half of likely undocumented adults and nearly 1 in 5 lawful present immigrants don't have health insurance, and without health insurance, access to care drops sharply. Once again, I would like to repeat, nearly 1 in 5 lawful present immigrant adults also lack coverage, compared to less than 1 in 10 U.S. citizens. By income, 24% of lower-income immigrants adults are uninsured versus only 5% of those in higher-income households. Why? The data shows it's largely because many immigrants work in lower-wage jobs in industries that don't offer health insurance. Private coverage rates are low, and while Medicaid fills some of the gap, eligibility restrictions leave many non-citizens without any coverage at all. Coverage rates vary by income and state. In places like California, where policies are more inclusive, uninsured rates among immigrants are dramatically lower than in states like Texas. These differences aren't just statistics. They represent real people who either can or cannot get care they need. A powerful paper by Jessica Hill, Darlene Rodriguez, and Paul McDaniel reminds us that immigration status isn't just a legal label, it's a social determinant of health. That means your papers, or lack thereof, can decide if you can see a doctor, afford medicine, or feel safe walking into a clinic. These barriers happen at multiple levels. First level, individual fear of deportation or being judged. Second, a community level, stigma, misinformation, and limited resources. Number 3, systems, policies that exclude entire groups from coverage. For example, many lawful present immigrants must wait 5 years before they can enroll in Medicaid or CHIP. Undocumented immigrants are excluded entirely from federal coverage like Medicaid, Medicare, and the Affordable Care Act marketplace. When immigrants do seek care, 1 in 4 says that they have been treated unfairly by a healthcare provider, sometimes because of race or skin color, sometimes because of their accent or insurance status. Black immigrants adults are more than twice as likely as white immigrants to report this kind of treatment. And for those with limited English proficiency, the obstacles multiply. Imagine being sick, going to the doctor, and finding no interpreter available, or having staff treat you impatiently. That's not just frustrating, it's dangerous to health. When COVID-19 hit, these inequities deepened. The U.S. government used public health orders to stop certain migration, and inside detention centers, immigrants faced high infection risk. Many federal relief programs excluded non-citizens or caused so much confusion that even eligible immigrants stayed away, worried it could hurt their immigration status later. But there is hope. States that expand coverage, like California, have far lower uninsured rates among immigrants compared to those that restrict access. Community health centers are bridging some of the gaps. And advocacy at every level, from local councils to Congress, can make a real difference. If we truly believe health is a human right, we have to remove immigration status as a barrier to care. That means policies that protect, not punish people seeking health, coverage access for all, regardless of status, and care that is culturally and linguistically responsive. The immigrant health story isn't just about policy. It's about people. People who keep our hospitals running, build our homes, care for our children, and shape our communities. So I'll leave you with this question. If health is a human right, what does it say about us when we deny it based on a passport, a visa, or a piece of paper? Until next time, stay informed, stay compassionate. It's your girl, Zia the Begum, and the mic is on.
Zia the Begum, here to stay. In her softness, she paves the way.